So unfortunately for most women, this is a bit of a canon event. So I think it's important first and foremost to kind of shift your expectations in terms of the US medical system. The first thing is that the US medical system specifically is focusing on reactive care, not preventative care, which basically means they are waiting until something is wrong, something is diagnosable, something is at a disease level before they take action. And that action, the majority of the time, is going to be in the form of prescription medication. A lot of times that is going to be hormonal birth control in this given case. The second thing to understand is that a lot of times doctors don't deem it necessary to run a full hormonal panel unless there is a history of repeated symptoms, which basically means that the first time you go and ask for lab work to be done, if this is your first time obviously voicing these concerns, you might not be necessarily getting a full hormonal panel even done. They might just be testing a couple specific markers there. Unfortunately, it is a bit of a broken system, so doctors don't innately not care about you. There's just a pipeline to this that they kind of tend to follow. So this is all about just prefacing how things are typically going to work for your experience. There are also obviously exceptions to this rule where you will have an instance where you do have a primary care doctor who is willing to run these labs, willing to hear you out, willing to suggest things other than prescription medications, but this just tends to be the experience for most people. The second part of this is understanding how your labs are being evaluated. If you do not have that history of repeated symptoms, what you are going to be tested is normally going to be a smaller panel, typically CBC, a metabolic panel, potentially TSH, but not necessarily a full hormonal panel. When everything comes back normal, just that we're asking the wrong questions, so we're not getting the right answers. We're not testing your hormones, so it's not showing that anything's off because we're looking at a completely different area there. I'm going to paste on the screen everything that my clients typically get done whenever we are looking through a full hormonal panel, and you can see that it's a lot more than just the things that are going to be tested on those three things I mentioned prior. Another part of this that's important to consider is if you are appropriately timing your lab work. We want to be going on days 19 through 21 of our cycle if we were having a regular cycle and we are not on hormonal birth control. The biggest part of this to understand is what you are evaluating against. When you look on the ranges on there that says reference interval, you are evaluating against what is normal. And what is normal on labs? It's where the typical US population tends to fall in line. And if you look around the typical US population, most people are not in the best health. So you can still technically be in normal ranges and not feel your best. And one of the things I do for my clients is evaluate against the optimal range. And this is where you're going to have the best quality of life possible. So when you get told everything is normal, it just means it's not necessarily to a diseased or diagnosable level just yet, but there's a period of time before you get to that point in which you can tick the needle back. And that is what we're focused on in functional nutrition, is preventative care, not just reactive care. When you get told everything is normal and you know things are anything but normal, I hope this gives you a little bit more clarity to why you are getting these answers. You might just be looking for the right answers in the wrong place.